Welcome to the Alameda County Pod Training Module for Vaccination Station Setup. A pod, or point of dispensing center, is a site at which medications or vaccines may be quickly dispensed to a large number of people in the event of a public health emergency. Saving lives is the key to the success of the pod. This module will discuss the pod vaccination station setup for a mass vaccination campaign. As a member of the operations team at a pod site, you have the central role in making the vaccination process successful. We'll discuss the process for setting up vaccination stations. Correct layout of the supplies used in each station should help improve your processing speed. Remember, rule number 1 in a time-critical event is speed. Speed equals survival. Station setup can impact the overall speed of the vaccination station. We'll first discuss the vaccination station, its overall purpose, and who will be operating it. What is a vaccination station? The operations section is the largest section in the pod because it's responsible for carrying out the main pod activity, vaccinations. Within the operations section, there are vaccination stations, or tables, that will be set up with supplies necessary to vaccinate clients. Each vaccination station will be operated by 2 people, the vaccinator, who will be giving the injections, and the vaccination assistant, who will handle support. Vaccinators can be nurses, physicians, pharmacists, or designated paraprofessionals with medical clearance. Vaccinators must also be prepared to respond to medical emergencies that may occur during the process. The following supplies should be available nearby: scales to weigh clients, blood pressure monitoring devices, and epinephrine and diphenhydramine in case of allergic reactions. Vaccination assistants will assist in pre- and post-vaccination activities, including preparing the vaccine, loading syringes, preparing clients for vaccination, and maintaining adequate supplies. Note, more detailed information on preparing vaccines and loading syringes can be found in the training module in this series, How to Give a Vaccination. But as a reminder, only prepare enough vaccine to meet the station's ongoing needs. Fill syringes at the time of vaccination only. Unused filled syringes must be discarded at the end of the vaccination session. You should use caution when handling vaccines. Be sure to disinfect contaminated surfaces, dispose properly of soiled materials and needles, and don't forget to monitor vaccine storage temperatures. Now that we've gone over the station's purpose and roles, let's move to the most important part, the setup. When setting up a vaccination station, there are 2 issues to consider: safety and function. During an actual emergency, vaccinators will be working quickly to process clients. Remember, speed equals survival, but we must also consider the safety of the vaccinator. In order to prevent needle stick, items should be close and within arm's reach. During the vaccination process, the vaccinator will reach for the syringe on the table, then reach for the patient's arm to administer the vaccine, then back to the table to dispose of the syringe in the sharps container, maintaining pressure using a cotton ball on the client's arm, and finishing with a Band-Aid. The continual arm's reach sweeping motion from one side of the table to the client's arm resembles an arc. In order to keep everything accessible within the arc or arm's reach curve, we'll need to place supplies in a specified order. Safety and function go hand in hand in the vaccination station setup. Let's discuss the design of the station setup to create the maximum speed while keeping safety as a primary goal. Vaccination stations should be set up for maximum efficiency. 8-foot tables should be set up for 2 stations, 1 on each end of the table, with 1 chair for the vaccinator and a second for the client to face the vaccinator. Clients can elect to sit or stand. Infants should be held in the parent's lap for vaccinating. All tables should contain the following items for a 2-station setup: tablecloth, non-sterile pads, also known as chucks, box of syringes, sharps container, nitrile gloves, sterile wipes, tissues, Band-Aids, vaccination station instruction manual, the green for go sign, pens, and 4 chairs. All tables should be set up identically to facilitate continuity and flow. Place the items on the table in a manner consistent with usage. If your table is against a wall, you can use the wall as a backstop. If your table is in the open, place supplies in from the edges to keep them from getting knocked off. Group primary supplies and safety items together within reach of the arc. Put expendable supplies like tissues in the middle of the arc, and place the go sign near the front of the table. This is an easy setup to use and efficient when restocking supplies. To begin setup, cover the whole table with a tablecloth first, followed by individual chucks, the non-sterile pads. A pad for each station allows you to remove the pad when soiled without affecting the other station. At the back of the table nearest you, place the items that you'll use for protection, such as gloves, hand sanitizer, and the sharps containers. Note, remember to keep sharps containers within the arc to prevent needle stick injury, but away from traffic flow to prevent spilling. Next, place the items used most for pre- and post-vaccination, such as syringes, sterile wipes, cotton balls, and Band-Aids. Easy access is key here. At the front of the table, place the reference manual and the green for go sign. This sign is usually used only in larger pods to signal that you're ready for the next client. It should be held high enough for flow control to see. Also make sure you know where the nearest emergency epinephrine injections and diphenhydramine doses are kept. Remember, as clients arrive at your station, the vaccinator should be prepared to vaccinate quickly and safely. Another issue to consider is the storage temperatures of vaccines, or cold chain. Each station should have a cooler. Cold chain coolers should be easy to reach and not hinder the flow of clients. Maintaining appropriate temperature controls is essential to preserve the effectiveness of the vaccine. Storage should be carefully monitored for temperature fluctuations and proper maintenance. At the end of the vaccination process, any untouched vaccine should be returned to the central refrigerator. Note, failure to follow the recommended specifications for cold chain can result in inadequate immune response in the recipient. Any compromised supply should be discarded. Vaccine cold chain and handling requirements are very important. Vaccines should be maintained at temperatures between 35 and 46 degrees Fahrenheit. That's 2 to 8 degrees centigrade. Do not freeze them. However, some vaccines, like influenza spray, may arrive frozen. Frozen vaccines should be thawed to enable rapid administration, but once thawed, never refreeze them. Vaccines should be shipped and stored in insulated containers. Styrofoam containers and cold packs are adequate for local transport and day use. If pods last for more than 1 day, arrangements should be made for close monitoring of vaccine storage. For longer-term use, you must use a refrigeration unit. Storage should be located in close proximity so that temperatures can be regularly monitored. Refrigerators without freezers usually perform better at maintaining temperatures. Vaccines should be stored centrally in the refrigerator, not in the door or on the bottom of the storage unit, and kept away from the walls to allow air to circulate around them. Vaccine refrigerators are designed specifically to accomplish this. Security is the third part of the equation for vaccine safety. Proper security measures need to be adopted in order to protect vaccines from vandalism or contamination. Now let's discuss the record-keeping processes that should be followed by vaccinators. Some emergencies, like anthrax prophylaxis, may not require full documentation, but in most cases, vaccines must be documented to track lot numbers and recipients. Records should identify the recipient's name and contact information, the name of the vaccine, the dose given, the vaccine lot number, the manufacturer, expiration date, injection site, the date given, and the healthcare provider's signature, date, and credentials. Proper documentation helps to ensure that those in need of vaccine have received it and that clients are not administered multiple doses. As a member of the pod operations staff, your role in the success of the pod results in lives saved. The vaccination station setup can directly affect the processing speed of the pod. Your knowledge of station setup can make a difference. We appreciate your time and dedication to becoming a knowledgeable first responder. This pod video training series is brought to you by the Alameda County Public Health Department, Office of Public Health Emergency Preparedness, in collaboration with Applied Creative Training, Inc.